think as we look at around the world, it's not just in the U.S., at kind of the directionality of public debate, of public policy, it's got some elements that ought to have us concerned. Issues are much more vivid now about insularity, separateness, fear, and conflict with each other. Instead of coming together to solve problems, we seem to be pulling apart. I don't like it. I think something's got to unite us, and it'll never be technique. It'll have to be purpose. We'll have to think about mission. And when you think about mission, you think about, why are we here? What are we really trying to do? And that draws me into a moral vocabulary. I'm not comfortable with it. I don't want to lose friends over it. But I think we really need to think hard about what's right. I think the vocabulary of right and wrong is treacherous territory. We have to be very careful to respect each other and those who disagree with us. We may disagree, but it doesn't make them bad. But we still have to inspect our values. So I'm going to talk about that. And I think it relates to health, because a threat to our moral foundations plays out as a threat to the health of communities and people. And the other avenue that connects here, and maybe I'm straining it, but it has to do with what is quality? What do we mean by professing quality improvement as our mission? Well, to me, quality has always meant nothing more complicated or nothing simpler than meeting needs. If you're working on quality, you say, what's the need I'm trying to meet, and therefore what processes do I have to engage in? And just like with social determinants of health, I'm coming to the realization that if we mean that our intent is to improve well-being, health and well-being, we've got to look at the preservation of the moral foundations for our work.